Our session is now being recorded. We are going to now turn the forum over to Mr. Harrell Carter, President of the Jackson-Madison County Branch NAACP. Mr. Carter, we are now in your hands.
Thank you, Ms. Nelson, Daphne Nelson, who is the Secretary of the Jackson-Madison County Branch of the NAACP, as well as the Office Manager of the State Conference of NAACP branches. Welcome every morning. Good morning. It is a good morning. It is good trouble, necessary trouble. That's the theme of this year's Martin Luther King Jr. holiday celebration of a living legacy. His legacy because he lived the life that we now want to emulate. And we're glad to have you here this morning. We have several activities throughout the day. We'll be announcing those periodically during this session. But right now, it is about health. We all realize that in this pandemic, that it is highly contagious and very difficult in order to suppress. But all of us doing our part, wearing masks and washing our hands, social distancing, not avoiding large crowds, we can solve this problem and we will solve it. But on this day, we highlight the life and legacy of Dr. Martin Luther King Jr., Reverend Dr. Martin Luther King Jr., for what he gave to this country. This is his holiday, national holiday. And we'd like to make sure that on this day, not only do we remember, but we also do service on this day, as we should 365 days out of the year. Our guest this morning will talk about this pandemic and talk about its highly contagious nature on communities of color. COVID-19 has exposed a lot of inequalities in our country, not only from access to quality healthcare, but also looking at the issues surrounding education, economic, affordable housing, rights to the ballot box, as we have all too often been more aware this year than ever before. We have four fine panelists, and I'll be asking each one to identify themselves and about their area of service. First up, we have Dr. Michelle Taylor, who is a practitioner here, and Dr. Taylor is a former director of the East Jackson Health Clinic here in Jackson, and she's also a member of a sorority that I need not mention because it's now represented by soon-to-be Vice President Kamala Harris. Dr. Taylor, would you introduce yourself, please?
Yes. Good morning, all. Good morning, fellow panelists. I am Dr. Michelle Taylor Moraney, and yes, I am the former medical director of East Jackson Family Practice. Now I have a outpatient clinic, Taylor Medical Center. So I practice family practice where I service patients from birth to 99 years of age, and I am doing primary care for those patients. So, and yes, I am a member of Alpha Kappa Alpha sorority and also the Links Incorporated.
All right, Dr. Taylor, you know, we're blessed to have with us as well a young man that I've just, as soon as we started talking about this virtual health summit, I think we've got a relationship now that will go forward. He's an expert in his field, and that's Dr. Orpheus Triplett, dentist, Memphis, Tennessee. Dr. Triplett, would you mind introducing yourself, please?
Good morning, everybody. How's everybody doing?
Good morning.
Well, as he said, I'm Orpheus Triplett. I'm currently the Assistant Dean of Community Oral Health and Outreach at the University of Tennessee Health Science Center, College of Dentistry. I was in practice for 20 years. During the course of that time, in my past, I have been the dental director of 3 different community health centers, and I'm currently on the board and chairman of the finance committee for Christ Community Health Services. I'm just glad to be here and glad to sit on this panel with my distinguished colleagues. Some of whom I know, others I'm looking forward to meeting. Thank you.
Thank you, Doctor. We appreciate you being here with your expertise. The next young man I want to introduce now is a Reverend of Morning Star Missionary Baptist Church in Humboldt, Tennessee, but he also is the Director of Public Education at our local regional Jackson Madison County Regional Hospital. Reverend Brabble. Reverend Brabble.
Brother Carter, we certainly appreciate you inviting me as a part of this forum. I just feel honored to be here to serve the community and to really share any information that I can concerning this pandemic and also concerning health in our local community, especially dealing with African Americans. I certainly currently serve as the Community Health Director at the Jackson Madison County Health Department. And we're just looking forward to being on this panel, and I just glad to meet all the other panelists. I know Dr. Lamar, and we certainly hopefully get a chance to better know everybody else on this panelist and also in our community. Thank you.
Thank you. And Dr. Lamar is a physician, trained physician, and she has master's degrees in public health. She works with the Tennessee Department of Health. And Dr. Lamar, if you would introduce yourself to our audience, please.
Good morning, and I am so appreciative of the invitation to join you all this morning. I am Kimberly Lamar. I am the Assistant Commissioner for the Tennessee Department of Health. I lead both the State Offices of Minority Health and the State Office of Rural Health Access here in Tennessee. I've been with the state of Tennessee in many capacities in leadership for the past 10 years. I am also, Dr. Taylor, a member of Alpha Kappa Alpha Sorority.
Whoa, that's not fair.
And I'm originally from Memphis, born and raised in Memphis. My family is there as well. So thank you.
So West Tennessee is represented well. So now we've got a feel for who each one of us, background, where we are, where we come from. That's a good thing.
Mr. Carter.
We're here to, yes.
I'm sorry, I failed to share with my fellow panelists that I am a proud member of Alpha Phi Alpha. So my sister's there.
I should have worn my Alpha tie this morning. I knew something was cooking. Wow, that is. Thank you, Doc. Okay, so we're gonna have a good discussion. One of the issues that this pandemic has exposed in a lot of our different areas, particularly affected the whole world, but in particular communities of color. I'd like to start with Dr. Lamar. What do you see as this pandemic, and we will defeat it, not going to be tomorrow, right. But what do you see as, because of this pandemic, most of us realizes that it has uncovered a lot of inequalities in our healthcare system. Mm-hmm. Would you speak to that, and what does the Department of Health for the state of Tennessee offer?
I will, and so COVID, as if you've monitored our numbers, our data that we release on a daily basis, you see that COVID-19 has had a significant impact on our communities of color. What it has done also is highlighted those disparities. It has highlighted those social determinants, including issues of systemic racism that we know have for years plagued our communities. It has also highlighted the barriers to care that have for a long time have contributed to the disparities that we see in many areas, such as chronic diseases. And now these same chronic diseases, these same barriers that have gone into play have also impacted those high rates that we see relative to COVID, whether it's cases, deaths, or in hospitalizations. And so What we see and we realize outside of the system of care and challenges with access, we know transportation has always been an issue. We know the number of providers and where those providers have been located in the state of Tennessee is and remains a challenge. But we also know that when COVID hit, we had challenges with reaching communities of color in terms of communications and how our messages were created and delivered. And so we have been very purposeful by creating messaging, PSAs, marketing materials that reflect the community, right? They're representative of people of color. And so if you've seen any of our commercials on the television and so on and so forth, we have been very purposeful in that area. We've also had a huge issue with language barriers. We see, particularly with our Hispanic community, that they were not even able to access many and even interpret a lot of the materials that we have. We weren't utilizing the channels by which our communities receive information. You know, we're considering, we had a one shop fit all, one size fit all kind of model. And so we were communicating one direction in one way. And so what my office has done is created materials and messaging that's multiple languages, including English and Spanish. But we also are utilizing our local channels of local radio, local media that target particularly our youth, young people of color, and then our seniors. And so also working alongside our pastors and our faith community to make sure that they are equipped, our churches are equipped to also deliver the messages and where it's received, particularly with our senior population. That's more important now than it was with testing, because the vaccine access and given where we are for vaccine, particularly with our senior 75 and up, it is important that our local grassroots level community members have access to that information. And so that's some of what we're doing to make sure that what needs to happen, what needs to be communicating, the behavioral changes we need to implement are reaching the people.
One of the things that certainly here in West Tennessee that we see that there is no mandate, well, a mandate, but unenforceable mandate on masks here in Madison County. There's various counties around us that have no mandate at all, at least to some that's close to Madison County. And of course, we're all fluid coming into shop, restaurants, work here in Madison County. We're up to about 10,000 people that has been, I think, affected here in Madison County. And I think we're up to, I think the death toll is close to 200, I believe, Dr. Taylor. If you would expound on the impact that social norms here in Jackson, Madison County, what does that look like from a practitioner? Because you see some of these patients almost every daily.
I do. I see quite a few people daily, and the impact of when, well, we stress the social distancing and the wearing of the mask and the washing of the hands. However, as we, go along our daily lives, we have seen, I've seen so many in the neighborhoods and in the community without masks and at different areas, and that is contributing to the spread of COVID in the community. But we have quite a lot of our people that are people of color. I've seen them wearing their masks. So they want to adhere to the guidelines and the regulations. But when we're not all on board, it still is creating this situation where we have rise in numbers of COVID, and it's really hitting us hard, because in the communities of color, those people are essential workers. They are out, working their jobs, and they can't afford to stay at home, and they have to do these things But then, you know, they do not have the proper access to care um, to medical centers or things that they need to keep them safe. And then in the home, you have multi-generational families. So you have a situation where you may not be able to, you know, socially isolate the way that you should. And then that is creating problems. So we have many different things that are affecting the rise of the COVID level. And, you know, it seems like we're not really getting the situation truly under control.
Hmm. Reverend Brad, will come to you now. Regional Health Clinic, Health Department here in Jackson. What are those numbers to date in terms of the number of cases that we have and the number of recovered, and those that, where are we with from the Regional Health Department standpoint of view?
Brother Carter, as of yesterday, we were at 9,926 confirmed cases. We're probably in another hour is going to get the newest results, but as far as recovered cases, we have 8,678 that have recovered out of the 9,926. So the recovery rate, unfortunately, when you mentioned about the people who have transitioned, we have lost 158 deaths here in Madison County. And the numbers are, they're fluctuating. We seem to get a huge spike after major holidays. After, for example, probably the biggest one we saw was the Memorial Day weekend, and then you 4th of July, Labor Day, Halloween, Thanksgiving, the Christmas, New Year's. So basically gatherings are the number one culprit of what we're seeing when we get big spikes in our cases. That I think the biggest spike I've seen was maybe about 146 on one given day that's been reported. But right now, like yesterday, we had 21. And a lot of times we can't get comfortable whenever we see cases like only 21, because oftentimes that's just a result of sometimes certain clinics with the labs, they only dump them in on certain days. So like, for example, on Sunday, those probably are people who were tested on Friday. So probably tomorrow and Wednesday probably would be a better example when we get those cases in to see where we at.
Dr. Triplett, you are in Memphis Shelby County, and Memphis Shelby County has, I guess, bears the load of infection from COVID. Your comments about Shelby County and of course West Tennessee.
I don't have the most up-to-date figures, but as of, I think it was Wednesday, the 13th, in Shelby County, we had at that time 75,495 confirmed cases, 1,062 deaths. So I'm sure those numbers have increased, by now. So as we know, this COVID, man, is not playing. It's a serious thing, and COVID, it has affected every aspect of our life. Every aspect of our health. And for dentistry and for oral health, anything that would stand in the way of patients seeking oral health care, that's a problem. So with COVID, the first thing that happened, in which understandably so, and it had to be done, we had to stay at home, and then we had only the emergency care being rendered. So most dental offices, were closed. Here at UT, we maintained a emergency care because we didn't want people to flock into the emergency room seeking, relief from pain. So it has really put a damper on things, because now patients have moved oral health care down the priority list, because concerns for life is much higher, obviously. So people, if they don't have to go in, they're thinking, well, I'm not going to seek oral health care. So that has been a problem here at the dental school. Fortunately enough, we're back up and running, and we're busy, every day. And I think it's because we've educated our patients and we've shown them that we've taken the necessary precautions to make sure that the environment in which they're being treated is a safe one. We've purchased, units that were aerosolizing, capturing units, so that when patients are treated, and these aerosols are produced from the hand pieces that we use. Well, those are captured in a vacuum type situation and carried to a particular unit and of course taken care of. So we've shown them how safe it is. We've even done plexiglass barriers at every treatment station. And can you imagine what an awesome task that was? If you've got 100 dental chairs on a floor, and now they were open, and now you've got to put plexiglass to actually shield each patient and protect each patient. We had to do that. So those expenses were incurred, but we've done everything we could in order to make people safe. Now, my position at UT, I'm currently charged with the responsibility of increasing our footprint or our visibility throughout the state of Tennessee. So I'm currently working on establishing extramural sites, as I'm sure Dr. Lamar is aware of, in partnership with the state, using some of their health departments in rural Tennessee, in areas where people don't have access to care. So COVID has really, as you said earlier, it has really exposed, I guess more barriers and the disparities. We already knew these disparities existed, but right now, what we see is that our current healthcare system, as it is designed, it doesn't meet the standards. It does not address or reach the populations of individuals who carry the highest burden of oral disease. So we're trying to do whatever we can to address those issues, and it causes us to be sort of innovative, creative, and try to find ways that we can reach the people. And access to care, when you think about it, access to care is not just people think in terms of proximity, they even think in terms of affordability, but it's more than that. You have to delve deeper into it, and you have to pull off these layers. Dr. Lamar mentioned it earlier when she was speaking. You really have to look closely at social determinants of health and social determinants. And when you look at social determinants, we're talking about, where people were born, where they live, work, and play. So you got people who live in communities, and say on one side they had a chemical plant, on the other side they had a lumber mill, and they grew up there. So then you begin to look at things. Why is it that in this particular community, why is it these people have a high incidence of certain types of cancer? Why is it that the water is contaminated? So for us as practitioners, there has to be a greater collaboration between medicine and dentistry, because when we treat patients, we're not just treating disease or pathology. These are beings. So we have to know more about them, have to be able to understand where they come from, what they're being exposed to, so that we can better treat our patients. And those are the things that we're trying to do, even at UT and teaching our students. We want them to know that you don't go in and just treat disease. You got to have a better understanding as to why this patient is a repeat offender as it relates to not showing up for the appointments. Look closer, talk to the patient, understand the fact that this could be a person who's a victim of domestic abuse. This could be a person, who has poor living conditions. So once we began to learn more and more about our patients, work and collaborate together, we can be more successful in treating the patient, because it's the whole being that we're concerned with. It's holistic in our approach to treating patients.
Yeah, it's just like the whole family. Dr. Lamar, I know that there's been recent issues about testing as well as contact tracing and about the availability of enough vaccine. What is the status of Tennessee, state of Tennessee, and its access to the vaccines at this point?
So there are a couple of challenges with the vaccine. I think what's been received in the state of Tennessee represents a little over 3% of the total U.S. available access to vaccine. We have a couple of challenges with the fact that we have two types of vaccines, the Pfizer and the Moderna, that we're currently utilizing across the state. But packaging and storage of that vaccine and the way it's shipped, particularly relative to the Pfizer, has been uniquely challenged because, for one, it requires that less than 70 degree storage temperature, which requires specialized equipment and freezers and how you mobilize and mobilize that vaccine and retain that temperature is unique to be able to disperse it across. And then it's packaged in pallets of 1,000 units of vaccine in one bulk package, which, if we were to give that to a local health department, a local, we'll say, community health center, one of our FQHCs, they would have to figure out within a short period of time how to vaccinate 1,000 people rapidly, which we know is not necessarily possible. And so we had to utilize our 95 plus, we have 102, I believe, health departments across the state, and make sure that they were equipped. They have the storage capability to hold that vaccine. Now, we also to begin to look at our healthcare workers, because without that healthcare workforce, we're challenged relative to hospitalizations and ability to care for and treat not only COVID patients but the rest of our community. So we've been able to utilize about 50% of the vaccine that we had available to us to be able to vaccinate our healthcare workers, and then now we're moving into our seniors, 75 plus. And so the amount of vaccine, again, is not under our control in terms of how the volume we have is really under the federal control. And we're at the liberties until we kind of hear from the feds as to how much new vaccine we have on hand. I think we have about maybe 14 of the 1,000 pallets of vaccine available, and then about 111 of the Moderna, which is packaged in about a box of 100. That makes it a little more mobile, but we have less of that vaccine available. And so you think of 14,000 vials of vaccine is all our state currently has. We're really limited. And so we have to be purposeful for making sure we're targeting the most highest risk. And that's that highest risk of not only hospitalization, but of death, and what we're seeing, which is why we are focusing on our healthcare workers and focusing on our senior 75 plus. For African Americans, our seniors 75 plus that we're seeing that are contributing to the mortality are seniors in our long-term care facilities. And we're seeing that our Black seniors, our Hispanic seniors, our white seniors even that are 75 plus are dying at a higher rate. And so we wanted to make sure that access is there. So pushing the majority of that to our pharmacies who partner with those long-term care facilities has been our priority to stop the death. Now we're in the place when we are expecting to receive new vaccine to be moving into senior 75 plus, senior 65 plus, to make sure that they're taken care of. But the health departments, because of the way they're structured, the way that they're centered within our counties, that's where we're mobilizing that right now. We're hoping with the Biden administration and the transition there, we'll get more and more vaccine allotted to the state of Tennessee. But right now we have a minimal amount available at this time.
Dr. Taylor, our no mores, if you will, in terms of the African American community, it's we're social people. We want to come together. I know that there is the self-care, the distancing, the not exposing yourself and not being around large crowds. As we're all social beings, the difficulty is to how do we stop infecting one another? The mass has become somewhat political. Should not be, should be just common sense. But unfortunately, people of color are, as we look at where we are, what are some of the things that you tell your patients about this disease that hopefully will get them to stop and think about potentially of going over to grandma or going out of town and coming back? I know that each physician and nurse practitioner and all of our public leadership have said we need to be sure that this does not become something that we have to compete with over and over again. Your thoughts on and message to the larger audience about behavior that we have in this pandemic.
Right, right. That is certainly one of the problems that we're facing is with each holiday and with each gathering, we tend to want to gather with families, and we have been in this pandemic since March, and we have often stressed to our, well, I've stressed to my patients, please, this year is just, it's a different year. So we are going to have to come up with different ways to reach out to our family members. But we're stressing that if you're gathering, especially for the different holidays, you keep your nucleus. You see the people within your family, but do not go outside of that. So if you don't see them every day, you shouldn't gather and have these dinners or these family gatherings, because you're introducing germs to a different household. And what I've been noticing is that when we oh, I need to take care of mom or need to take care of dad, the older people, our adult people trying to take care of parents, it's a challenge. It's a challenge. And I've heard that, well, how do we meet those needs and take care of them when they have their own underlying health condition? Because sometimes they may be in a household by themselves and they cannot go out, but you have to figure out how you can meet the needs of your older family members without exposing them to COVID. It, it's been quite a challenge. It's been quite a challenge. And what I've noticed is that the gatherings have been, you may see families that have utilized the technology like the Zoom and try to be around the family members, but you still see quite a number that has been, with each holiday, like Mr. Brabham had mentioned before, after each holiday, there's been a spike, and we've seen it. We've seen it. So it's, we can only, educate and continue to say that when you are in these gatherings, there's a potential of developing COVID, and you will see it, that 2 weeks later. You may not see things immediately, but then those people go on and they bring it back home and it just spreads into the community.
Mm-hmm.
So,
one of the things that's we have to keep in mind too, that we have people that are asymptomatic and they are spreaders, but they're not showing any symptoms. Reverend Brabham, when we look at where we are in this pandemic, we must realize that even though we say that these patients have been infected, but they have recovered, are you getting any scientific data that says we might be omitting the fact that a lot of these folks that get it, some of the folks that get it and overcome it, are still have long lingering effects on your major organs that we're now beginning to find out that is delayed reaction to the exposure of COVID-19? Your comments?
Well, a lot of the data, I feel that right now is a little bit too early. And from my personal research, most of probably the closest thing that we have to relate COVID-19 to was the SARS outbreak in 2003. And of course, even with that was very limited in the United States, the number of individuals, I think only like 8,000 or so affected. But people who recovered from that, most of them had long-term effects, was chronic fatigue, shortness of breath, a lot of chest pains, and of course, some of them are also having, body organ failures, with kidney problems, those type things. So I think, personally, I feel from what I've been reading, it's going to take probably a little bit longer, to find out, because one of the things that you had mentioned about asymptomatic persons having it, I really believe that, and just from my congregation alone, I started having people with COVID-like symptoms as early as October of 2019.
Wow.
Not saying because, of course, we didn't diagnose them. Nobody could diagnose them. Nobody knew what was going on. But I had congregants that were out for, a week or two. And these are faithful worshipers that didn't know what's like, Pastor, I don't know what's wrong with me. I got, it's cold. They checked me for flu, strep, none of that. I don't know what's wrong, but I just feel, I was just incapacitated. So I think that once we begin to look at antibodies of people, when we get down that line, I think we'll find out that probably more people were infected than even what we have truly diagnosed.
Mhm. Dr. Triplett, when we look at where we go from here, and you've mentioned the exposure of inequalities, what are some of the things that you see that we can do better at?
Right now, let me address how we can help to educate our community. As providers, healthcare providers, once we have the presence of a patient and we gain their attention, we have to educate. Obviously, all of us, when patients enter our doors, we're doing the routine, we take the temps and those types of things. But then we've got to ask those questions. We have to have that passive interrogation, and it has to be deliberate and it can't be routine. And we have to pay close attention to specifics. For example, if a patient were to come in and they say, well, they're coming in for a routine cleaning. I haven't been in for 2 years or 3 years. And I just thought, doc, I needed to come in because, I've noticed that I've got a little tartar buildup and my food is tasting different. Well, we can't just write that off. Right there is a red flag, right? At that point, we're talking, maybe hypogeusia or dysgeusia or something like that. So we have to make note of that. If a person has a alteration in the taste of food, we don't play that off now. As a dentist, I make note of that, and then we have to take the necessary precautions, follow the protocol, report to the health department, talk to the patient, talk to their primary, because this could be a patient who's asymptomatic otherwise, and that might be the only symptom they have, and there we have a case of COVID possibly. But we have to be really careful and not to just carry on as routinely. So we have to educate the patients. And I believe in the theory of each one, reach one. If I can talk to an individual today and really convince them of the importance of following protocol to the extent that they will go back home and share that, practice that within that family, other families. Well, we might not realize what we're doing, but that pebble tossed in that stream, those ripples, man, they can really flow downstream. And the other thing as it relates to healthcare, how can we change the system? How can we improve the system? Right now, what we're doing is we're constantly jumping in the stream and saving people. But at the same time, nobody's thought about going upstream and say, why you keep falling in the stream? So we've got to go upstream and see if we can't, and we'll have to do both. We're going to still keep people from falling in. And that's going to sort of relate to, all of those things. We have to be more
Intentional.
along those lines. Yeah, intentional.
Yeah.
All right, we got to be more intentional. Thank you.
Yeah.
Thank you.
Mhm.
So
Yeah. Dr. Lamar, you mentioned that the media blitz that you all had, and it sounds like, and I have seen some of those Tennessee ads about masks in particular. And I believe that you indicated there was more media preparation that you have. I've only seen that one, and maybe I've missed some others. I very seldom hear it on our radio stations. How could we get our public and our media And I know they're doing a lot. Some are doing more than others. But in order to get the message, what are we saying to our community leaders from the state standpoint of view? As we look at a lot of the inequalities that we have established, I noticed that here locally, we don't even recognize that gun violence is a health issue from a standpoint. We have a lot of holes within our policies and within our laws. As we look at our mental health conditioning, I think most of your jailers across the state of Tennessee and the nation would say on average 60% of those that are locked up in our facilities have some mild to severe form of mental illness. Our jails has become.
You're muted.
How do we address those issues with not only with public media, but how do we also get down into the grit to say we can do better than locking up people that need health care?
So, you know, a lot of those issues are stemming from the fact that, and just to be transparent and just to be real and talk about the folks leading a lot of this effort, making decisions, providing health care, don't necessarily mirror the communities that are necessarily experiencing all the disparities. We have to do a better job at being representative and being at the table at many of those instances where those decisions are made. I think that's part of the challenge, is that decisions are being made for our communities without us weighing in, without us being part of that. And so we have to be purposeful. We have to find opportunities and identify opportunities where we can have a voice. And so when policies are being developed, when decisions are being made, making sure that we're there. One thing that my Office of Health Disparities Elimination at the state has implemented is a health disparities task force. It addressed not only direct health care, it addressed all of those social determinants, whether they're economic, education, the access issue, whether it's something as simple as transportation, where we place not only our health facilities, but where we place our providers, making sure that we have providers who represent our communities of color being able to serve our families and our communities. We're working closely with our HBCUs in training and making a pathway from K through higher ed to professional education to make sure that there are opportunities for us to have a representative workforce. We're also, through our Health Disparities Task Force specifically, have created a partnership, which includes not only state government representatives, but representatives from our faith community, our nonprofits, our education academics, both from K through higher ed, and then members of the community as well, to come to the table. Let's think upstream, as Dr. Triplett said. Let's think what we can do, what needs to happen, so that we're responsible. We're hearing from the community, they're weighing in, they're coming up with the solutions for the community, and then we're putting those efforts into place. And so we get away from me and a few of my colleagues at the Department of Health trying to figure out what's best for Jackson. We want Jackson to be at the table, Jackson to say, this is what our community needs, so that we put that into play as opposed to the opposite. And I think whether it's education, whether it's crime justice, whether it's any of the other areas, it's representation, it's table, it's being proactive and engaged, and making sure that all communities are heard, all sectors of those communities are heard as well, and be able to weigh in. That's the best approach that I feel that needs to happen. That's a starting place, because that just has not happened. I think also from a healthcare perspective, we have a workforce within health that also does not mirror, right? And so when we're serving those from the community, they are low income or Black or Hispanic, we don't understand, or the workforce in general does not understand, what is contributing, what at the local level, social level, economic level, genetic level, family level is contributing to why they're disparate, why their disease rate is higher, why they can't follow a certain diet to control their A1C. There's a lot of things that are individualized that we have to recognize. And so that's going to involve understanding bias. That's going to involve cultural competency. That's going to involve bringing in individuals who are willing to do that work and deliver services and care that are equitable and culturally responsive to the community. And so it's a lot of changes. This is a new paradigm shift for the Department of Health, but needs to be a paradigm shift for the rest of the state as well for us to get there.
We cannot go back to normal. Ms. Nelson, are there any questions in our chat box or Q&As? If you're aware, again, coming up at 11 o'clock today, don't forget that we have the drive-in rally down at the Jackson Civic Center. Just pull up on the lot. You'll be able to park, turn your radio on to 101.5 FM, and we'll start the services at about 11 o'clock. Daphne, are there any questions from
Yes,
the
Mr. Carter.
listening audience?
We do have two, and you can direct this to appropriate panelists, member. The first question we have is, what are some initial strategies that can be utilized to promote comprehensive health, medical, dental, or oral and behavioral health in the era of COVID-19 and beyond?
Well, we'll go back to Dr. Lamar. Dr. Lamar, you spoke about this. We have to do things different. We can't go back to normal. We have to do better than normal, both intentionally and in some cases boldly. But you open a line of communications. You do have some interesting initiatives that's ongoing. To this questioner, what would you say?
I would say as much as they can get involved with some of the conversations that we're having. We have some deliberate work groups that are representative of our communities that are doing some great work around access and also at the local level, there's opportunities. Every county across the state of Tennessee has what we call a county health council. Those councils now are not or limited in terms of representation from the faith community, from our nonprofit communities, from our Black and Brown communities. And so as much as you can, get involved at the local level in terms of participation on those health councils. That's where those local decisions on health are being made. That's where the priorities are being set. We are also have a variety of resources. Our programs now all have a requirement that we're have to develop our programs with the equity lens. And so there's so many programs that are offered through the Department of Health. And as much as you can go and see a lot of that at pn.gov/health. And then also my office, we have a variety of staff that are available to help navigate in individuals across the state to local health resources.
Well, I want to address that too. I know that there are, as you say, resources available, but sometimes when it comes down to being an advocate for our patients, we have to stress where patients can get those resources. Sometimes what I see is that when I direct patients to different facilities, they often feel uncomfortable going because they feel that they're not being heard, their needs are not being met, or that if something should come up and they can't follow, especially like in the behavioral health arena. I've heard many times where patients say, well, they're not taking, or I just feel that they're not really listening to me. And I know with my clinic, I am developing relationships with a social worker, and now I'm trying to develop a relationship with the Helping Hand dental program, so that my patients are able to access different things and to get that care, that 360 care. Because right now, I've identified a lot of things, and they need total care, head to toe. And a lot of the social issues that arise once you figure out what's going on with the patient and how to meet their social needs, they can get the physical need met, or the but a lot of it's, you know, that they have underlying behavioral health needs, that depression, that anxiety, and that you see a lot more during COVID.
So we have to do the whole family, not just one individual. The second question you have, Ms. Nelson?
Yes, the second question is, we are trying to communicate the need. Sorry, let me go back. What are some resources that can be presented or used in communicating with some of our Black elderly people? Some of them are wanting to wait until they see the actual results of the vaccination 4 to 6 months from now.
Mhm. Yeah, that's that fear of going back in yesteryear to those experiments, Tuskegee experiment and several others throughout the nation. Science is a wonderful thing these days, and obviously we have to believe in it, but I understand the hesitation. Right now, we do not have enough vaccines. We're working on that. I think as a national level, I think it'll be more emphasized and in the next few days. But I think when we look at our elderly population as we do in our criminal justice system, a lot of our jails are full with COVID, filled with COVID, and they get less attention in several places. Our local jails are not doing as much as we should do, that we could do. But Dr. Triplett, do you have any comments along those lines?
As far as, I'm sorry, any comments on the lines of the local jails and things like that?
Well, they were talking about the elderly people who were somewhat skeptical about the vaccines, but you know, we have a lot of pockets of that. Mhm.
That's I think as healthcare providers, we have to lead by example. You know, if I can tell a person that I've had the vaccine, you know, and then obviously that's a great stride toward encouragement. But at the same time, you know, we have to also tell these individuals, you need to check with your primary care physician, because it's not just say do it, don't do it. You know, it's customized to each individual. You know, some individuals may have something that well, they might have some concerns. Their physician might have some concerns. I don't know, but I wouldn't just blindly say go take it. You know, to the elderly, I'd tell them,
Yeah.
encourage them to take it, but check with your physician. Talk to them first, and let them know that I have had the vaccine, and if we're going to actually rid the community of this dreaded disease, we're going to have to take action. So.
Yeah, taking action and communicating well with all of those, particularly those that doesn't have direct access to the quality care that we have. Daphne, how are we on time? I think we're
And
probably
it's time to wrap up, Mr. Carter.
time to
For
wrap up.
closing remarks.
Closing remarks. Okay, we keep us on task. Let's start in reverse order. Dr. Triplett, with a few, just short closing remarks, please.
Yeah, well, I'd just like to say that, you know, at UT, we're trying our best to meet the needs of the community, and we're looking to spread out throughout the state, rural Tennessee, and provide access to care to those individuals who currently don't have it. And we're going to work closely with, you know, physicians. That I think at the academic level, the buzzwords are now IPE, interprofessional education, as well as interdisciplinary. I think as we move forward, that's what we're going to have to focus on, you know, collaboration and coalition building within the healthcare community.
Reverend Brabble?
Yeah, Mr. Carter, one of the things, sort of going back to that last question about, I noticed that even at our distribution sites that we have been doing for, it's very few people that look like me actually come in to get vaccinated. So one of the things that I'm trying to work on is trying to work with some of the faith-based organizations in our community to get them to be possible vaccination sites. So we're looking for that, and maybe that might increase the number of people who will be involved.
Well, we can help you out. Our organization, NAACP, can help you with that one. Dr. Taylor.
Yes, yes. And I agree with him on that. And certainly I have many patients who have inquired about the vaccination and wanting to know if they can be vaccinated at my site. And I am trying to become a site where patients can get vaccinated because they tend to trust their primary care provider
Mhm.
instead of, I had some that had tried to get vaccinated at the fairground, but wasn't able to get there. And also transportation. If you're not in a car, if you ride a bus or a van, transportation van, you can't go and just get, stand in line for a vaccine because I think that was a drive-through. So, once again, we got to look at all of those things that prohibit a person from getting the vaccine when they actually want the vaccine.
Okay. Dr. Lamar, I know that you're doing a lot. There's more that we all can do. Some of the high points that you see, what does the future look like for you in this after this pandemic?
For right now, I just want to assure the community that we are taking the equitable approach to not only COVID testing, but also vaccine access. As vaccine access increases, or as we receive more vaccine in the state, we have plans to make sure that we're addressing those needs. Like Dr. Taylor mentioned, transportation is a huge need. I have a meeting actually tomorrow to discuss transportation, but also more importantly, we have to as the Department of Health, also think through how we can make that access more equitable. We are looking to move outside of the walls of the health department, move into the communities, work along with our church partners, as we did when we provided testing. We worked alongside our Black pastors, our Hispanic pastors, and all over the state to provide access to testing to more than 20,000 individuals of color. And so we're taking that same approach as more vaccine becomes available, so that we can have essentially walkability for individuals who want that vaccine. But the more vaccine that we have available, the more opportunities others will see people of color being vaccinated. That'll encourage others to want to take part in this process. And so I just want to just make that assurance that is a strategic mission that we have in place at the Tennessee Department of Health, and it has been well received at every level of the state government, that we take this approach to ensure that all members of our community have equal access to care and have equal access to prevention.
Yeah. We're all working on the same page. It's been a pleasure and a joy talking with each and every one of you this morning for your expertise and what you bring to the table. This will not be our last effort in this type of Zoom conference about various issues, including healthcare. We want everyone to be safe on this day, give back to this community. There's several opportunities to volunteer. Most of our fraternities and sororities are having a special opportunity to get out and work with the public safely. We want everybody to be safe. This will be a better place after COVID. The NAACP Jackson Madison County branch thanks each and every one of you for your participation this morning. And with that, go out and do and make good trouble necessary trouble, because this is an opportunity for Dr. King's legacy to live on. Have a good rest of the day, everyone. Volunteer.